Let's talk about it with us right now. Maybe tears or laughs out loud. Let's make a difference as we speak through conversation for our future and future generations. Let's talk about it. Let's talk about it. Let's talk about it. Let's talk about it.
Girl, I was over here jamming. Hello, everyone. Hey, ousters, new ousters. We know we're a little late. Don't judge. Life be lifing, okay? And we are mothers, and my co-host is a wife. I don't have that problem. Um, it's a good problem though. Maybe I'll be there eventually. But again, I should say,
There it is. You
um,
will. I have faith.
well, you got more than I got.
I'll have faith for the both
I
of
think
us.
I've gotten look, I think I've gotten real cynical about it. I'm like, you know what? Child, I'm good.
Or that.
My kids are good. Mm, I don't know. Whole
I
nother
gotcha.
topic.
I gotcha. But this Sunday is our final live dedicated to breast cancer awareness. So thank you everyone who's kind of stuck with us for all of our lives that focus on breast cancer awareness. And we truly hope that you guys have found some value in it. And just know we're grateful. We're grateful for your, you guys hanging out with us and watching. And um, we hope that again, this has brought you some. It's been interesting, but then also you may have taken something away from it, or maybe even sparked you're having a conversation for getting, your self exams and or going to get your mammogram done. Um, yeah. And we were hoping to have a guest for today's episode, but it didn't quite work out. But we have an equally valuable tool to help us with this particular episode and it is really what doctors wish patients knew about breast cancer prevention. Can you always prevent it? Sometimes it's hereditary, so I don't think there's a foolproof answer, but we're going to find out. So drop any
Girl.
questions that you have, like in the chat.
Mm. Yes, I'm over here trying to find the article in my
Mm,
emails. I do apologize.
okay. Um,
Mm. I'm sucking right now.
no, it's okay.
I
I'm going to
really
go ahead and get it
I
pulled
really
up.
thought that we were gonna have a guest, so I was kind of like, yeah, okay. I don't know what I did with it. I'm joking.
I was like, that ain't it. Hold on. I'm trying to find the right this is actually a really great article. And I think it goes in depth and does have links for like other things. I'm just kind of scrolling through it to kind of see where we can start off. Um, but I thought this is kind of neat because it's what doctors wish patients knew. Um, and this is not quite it because I can't read it. Sorry, y'all. There we go. Nope, that ain't it either. Sorry. Okay, it's a
It's
little
okay.
tiny. I was trying to get it bigger. I was trying to get this bigger. Let me try one more thing. Let me try one.
Um, let me try to find this thing.
No.
What?
Mm. Y'all bear with me.
What doctors wish you knew? Patience.
Um, I don't think that's any better, no? Dang. No. Mm. All right, guys, bear with me. I'm feeling a little bit under the weather. And okay. I'm gonna try one more visual, you guys. Let's see. No, that made it worse. All right, we'll just go with this one, I guess.
I I'm so
Yeah.
sorry to see any of that. It's okay.
Okay.
What it is. I'm putting keywords in my search and it's still not coming up. Um,
Mm,
I don't know why. Yeah, it's still not coming up. I'm so sorry. Oh, okay. I'm gonna try to do that. Um, let's go back to dates.
oh, I'll tell you. It says, hang on. Here, I just sent you.
Which email did you send it to, babe?
The same one I always do. Mm, let me send it. Hold on, I'll forward it. Okay. I just.
Resent it to
Mhm,
help us sister out
mhm.
because I can't find a junk worth a dang. Okay. Sometimes I have to go out and then come back in.
Mm. Winner, winner, chicken dinner.
Winner, chicken dinner.
Winner, winner, chicken dinner. We getting
And
there,
I'm sorry
y'all.
that I am sucking. Girl, I see it. Thank you. You're awesome, girl. I probably would have never found that. Oh, you know what? I wonder if I deleted it thinking it was a link for one of our lives because sometimes I delete.
Oh,
I bet you that's exactly what happened.
yeah, and it's
Uh,
not like they have limits on your Gmail nowadays. You can't have too many like emails
girl,
and stuff. Any way to make an extra dollar, like we get it, but we hate it.
girl, truly hate it. Okay.
Mm,
So I unfortunately, you're right. I'm a little disappointed that we do not have our guests. We had a potential breast cancer survivor guest, but it didn't work out. However, this article I think could be really, really useful, or
mhm,
just as useful and beneficial, if not more, right? Because this is uh doctors
mhm.
saying what they wish patients knew
Uh,
about breast cancer prevention.
yes, and it is from the American Medical Association. That's AMA. So it's not, it's not just like opinion based. It is coming from a medical association that's providing this. And the website is it's AMA-ASSN.org. So it's not fake news. It's coming from actual doctors' perspective. So, which we find to be, I think most people appreciate more. Not just theory, it's coming from doctors and what they've seen in the field and whatnot.
Right.
So if you are joining us, don't be afraid to drop in the chat any comments that you would like to throw out there for our ousters, and we're going to go ahead and get it going. But it is again what doctors wish patients knew about breast cancer prevention. Um, so let's do it. Let's see. So, first and foremost, it is an uncontrolled growth. So, breast cancer occurs when abnormal cells in one or both breasts grow. Ooh, sorry, that was loud. Grow uncontrollably. This is said Dr. Gurin. I hope I said that right. While all cancers involve uncontrolled, unregulated cell growth, the type of breast cancer is determined by the specific kind of cells in the breast that are affected. Additionally, breast cancers are also classified by certain types of proteins or genes each cancer might make, she says. Okay, that's fair.
Also, the cause of breast cancer is unknown. There are multiple my bad. There are a multitude of risk factors for breast cancer, some of which that are beyond our control, said Dr. Gurin. Is that how you said it? Gurin?
Gurin? I don't know. I hope I said
Gur
it right.
Gurin? Gurin? I
Gurin?
don't know.
Mhm.
Gurin? I don't know. I'm so sorry. Please do not. I don't want to offend the doctor. So if I chopped up your name, I greatly apologize. And if you would like to come on,
We're here for
we
it.
are here for it, girl. That part.
Don't threaten me
Okay.
with a good time.
I mean, um, for example, the female sex age and genetics are not modifiable. However, risks that are modifiable include high BMI, alcohol intake, and smoking, she added.
Mhm.
I'm sorry.
What do
BMI?
you don't know?
Am I
Your
am I slow?
body mass index?
Oh, girl, I felt so slow just now. Like,
Oh, this is gonna be a tough one. Okay. Yeah. Let's see. And I know, like, I think that was the thing to say. Like, I was just thinking it was interesting. Like, how do you? There's certain things that you can't control when it comes to it, as far as like genetics and stuff like that. But there's other factors that you can. So I'm like, is it fully preventable? No, because your genes are your genes. But there are things that you can do on an individual level that's outside of your genetics and whatnot. Let's see. So knowing your risk factors. So while risk factors for breast cancer are broad. We think primarily about age. Around the age of menopause and after menopause is when breast cancer risk goes up. Oh, in women. Okay,
Mm.
says Dr. Jin. Family history, of course, is another big one. That includes genetic mutations that we now know of, such as BRCA1 and BRCA2, which I believe is the BRCA gene. That's how I've heard it said. I don't know what that means fully, but it boils down to genetic mutations. There's also this whole concept of, estrogen exposure, which can be both endogenous within the body or how much your body produces versus exogenous. I need a dictionary. Okay. So is it like one's internal versus exogenous? Okay. From okay, external from medications. Ha! I do remember some of my medical terminology.
Okay.
um, then other things like alcohol and smoking are thought to be associated somewhat with breast cancer as well. Interesting. I mean, that's hmm. I mean, isn't that like one of the things with like this is when it comes to smoking in general, it causes I mean, now it's well known, but it wasn't for a very long time. It can cause a multitude, hang on, of cancers.
Bear with us. As we always say, we are parents and kids come first, so it is what it is. I'm gonna wait for my co-host to come back before I start on this one.
Sorry about that.
No, girl, you're fine. Um, I I can appreciate this one. This is a long one.
Mm,
Hopefully,
mm.
I'll get through it without embarrassing myself or fumbling over these words on this here live. But let's see. Um, I think this is really a good point to bring up. It's important to check father's side too. I think some of us get kind of hung up on our mother's side of the family on occasion, and we do sometimes forget, hey, your genetics come from not just your mother, um, but definitely your father too.
Uh-huh.
Um, oh, there it is. People often think that breast cancer travels along the mother's side. So their family history on their father's side doesn't matter, said Dr. Guerin. The truth is each side contributes equally. I think we often ignore the father side because we don't see breast cancer as in men very often, but men can carry the gene just the same. Additionally, we often think of our parents and siblings, but our risks wait, I said that right? Additionally, we often okay, yeah, I said it right. Okay. We often think of our parents and siblings, but our risk of carrying the genes is affected by our second and third.
Hmm.
Oh, who knew? Second and third
Mhm.
degree relatives, she added. Shut up. I would like women to know that the cancer of their aunts, uncles, cousins, and grandparents all affect our risk. Huh.
Huh.
Okay. One needs to be an active investigator to find out if someone in your family had breast cancer or any cancer, but it's important to find out, Dr. Guerin said. Lord, I hope I'm saying that name somewhat right. When I take a family history to look for patients who might carry the gene that puts them at risk for breast cancer, we go out to third degree relatives. Oh, look at that.
Who knew? I did not know that.
I did not because usually when they talking about, like, let's just say diabetes or high blood pressure, I thought they kind of stopped with parents and grandparents and siblings is what I always thought. I never realized that it goes. beyond that. So not only check the father's side, but and that makes it that can make it a little, depending on your family dynamics, that can make it a little bit harder for some than others. Um yeah, who knew?
Absolutely. Yeah.
Wow.
Yeah, that's bonkers. I didn't know that. And when you go
Yeah.
to the doctor, they don't typically, maybe because it's not a specialist, they don't typically go past grandparents. It's parents, grandparents, siblings, like you said.
Mhm.
That's it. They
Mhm.
don't. Interesting.
Mhm.
I wonder if it's something that's newer. Maybe. I wonder.
Maybe with research and I guess things that have come up, maybe that's why they're taking it out a little bit further. And I could see it. It would make
Mhm.
sense if a uncle or aunt um
Yeah.
had it. I could see them being like, "Okay, this might put you at a higher risk."
I mean, I know that, and it's funny because now that you have like all this like DNA, and I don't know if this article goes into it because I don't fully remember, but like there's all this testing that's available now to like for not just not just to find out who your people are. It's more to the effect of like, are you predisposed for certain genetic things? But the bad part about it is that it's not affordable and available because it's not affordable for everyone to run all of this testing. And to be frank, it should be easier to access those types of things as opposed to being reactionary. It's more preventative because you know ahead of time that you run a risk for ABC, then they can start testing you for that earlier.
I agree, but I think some of it, I know from my end. I can't speak for anybody else, but some of it is trust issues. Like, I don't trust y'all with my DNA because I done heard some really
Hmm.
strange. I'll say strange because lack of a bet. I done heard of some real strange stories. So it just makes
Strange, effed up.
like that part, that. Thank you for saying it because that's really along the lines I was thinking about. I done heard some real effed up
Mhm.
stuff that has come up from um and sometimes it's not even the DNA testing or the what's the word I'm looking for? The ancestry or the
Mhm.
sometimes it's not even that type of a testing. Sometimes they're just you going in for your basic testing, and sometimes I think it's a little bit of a trust issue. I don't know. You know what I
Um,
mean?
no,
Like,
that yes, because if you haven't seen this or heard of this, you should probably go watch that HBO docuseries about it, about Henrietta Lacks, who they basically took her DNA, and her DNA had this way of replicating, and they took it, and basically is how they were able to make all of these medicines that really benefited a lot of people. But they profited from it for many many years, millions and billions of dollars, because the cell keeps replicating itself. So while they're sitting here profiting from it, she was not. And I believe they either did it without her consent or without her knowledge of what they were actually doing with it, and she ultimately had to sue.
I wonder how she found out.
I don't remember from the movie, but I remember even her family, because I think she passed away before the lawsuit ever. Because you know how it is with these lawsuits. You might sue
Mhm.
someone, and then
Mhm.
if you win, they'll appeal it. Blah blah blah. They go back and
Spend
forth.
years in
Extend
court. Yes.
years later. Hopefully, there's a resolution, but not always. Um, but y'all can Google it. It's called the Hepla. I think it was the Hepla something. I don't know why I remember that. But Henrietta Lacks, just look up her story. And like that's just one aspect of it that you might feel like that's kind of shady. But on the same token, a part of me, like some of it, it's illegal to share your health information with anyone that you choose, who you do not designate to have access to it. So if this type of testing and it's something that you can afford and it's done within the medical community, theoretically, because ain't nothing is 100%, then you should be safe, if not fully safe, protected. Because if it gets out somehow, then hey, we suing because you should have kept better care of my data, which I didn't. So there's that piece of it. But like, there's this actor who they did like this genetic testing, and I forget his name, where he found out that he carried the gene for Alzheimer's.
Mm.
He carried the gene for Alzheimer's so much, though, it was during the middle of a filming of a documentary documentary that he was doing, that they had to stop filming because he didn't know. And they were like, listen, we have to tell you that this is what came back. And it was kind of like, so, and they had to stop filming. And I forget his name. It's one of, I don't know, it's not one of those Hemsworth guys, but it's like some Australian, Aussie type accented guy. Very, I don't know. It's not Thor, but Thor-ish. I can't remember his name. But yeah. So it's valuable. But with good reason, understanding like, hey, what y'all doing with this information? So let's see. So start screening at 40. So the current recommendation to start screening for breast cancer, in average risk women is 40, said Dr. Jin. However, if they have a family history of early breast cancer and a first degree relative or other risk factors, we may want to start screening earlier. It's very individualized at the end of the day, noting that screening recommendations vary by accrediting body. Dr. Gurin emphasized that women beginning at 40 years old should start yearly screening mammograms. Yeah, that makes a lot of sense.
I apologize. It does. I can
Hmm.
see that. Yeah. Okay. Different screening tests are available. There are several different screening there are different blah, blah, I'm so sorry. There are several different screenings, said Dr. Jin, noting that a mammogram is the most common one. Other methods of screening include ultrasounds as well as breast magnetic renaissance what?
Oh, like an MRI. Oh, it's an MRI.
Oh, just say
Okay.
MRI, right? Like, just speak a language I know.
MRI. Everyone knows with MRI. You'd be like, oh, that the donut.
Thanks. Um, that I don't, girl. Well, now I know the full word for MRI, right?
That's a
The
mouthful.
full meaning, right? But for most people, we start with mammograms. She said.
Hmm. Um, and typically, if they feel like there was anything of concern, that's where that ultrasound would kind of come, because if you have that dense tissue, or as they say, lumpy boobs, it can kind of affect how that. But if you're getting regular screenings like annually, it should be able to see if there's a difference in the mass of your breast from one year to the other. Um, and this, yeah, so screening tests are not perfect. Screening at 40 instead of 50 saves more lives. But one caveat is that the younger people are, the more you pick up things that are not cancer, which is called false positive findings, Dr. Jin said. Younger women have denser breast tissue, and breast tissue is dense. It is very hard to differentiate normal tissue from something that may look like cancer. It is not uncommon to need, hold on. Okay. It is not uncommon to need to perform follow up testing, which includes additional mammograms and sometimes biopsy after an abnormality is picked. Y'all, I'm on the struggle bus.
Girl, at least you wasn't just staring at the word like, "What?"
my it's because my head hurt. All right, I'm like a booger. Nothing is making sense to me in this moment. Hold on.
I was over here like,
Okay.
"What?"
Okay, got
Okay.
it. Okay, okay. Bear with me, people. Bear with me. The Tylenol is working. It is coming together.
Good. Good.
It is not uncommon to need to perform follow up testing, which includes additional mammograms and sometimes biopsy after an abnormality is picked up on a screening mammogram, only to have everything turn out normal in the end, she said. Got it. I always counsel my younger patients, especially those getting their first mammograms, that it is common to see false positives or be called back for additional images. There's no need to panic if that is the case. Wow, look at that. Because the chances are still that everything will turn out fine. Otherwise, the anxiety following an abnormal screening mammogram is huge. I can attest to that and can upend these women's lives for weeks or even months, which is no small deal when they have busy lives with families, kids, jobs, Dr. Jen added. Even if you single with no kids,
Not
it's
only that, but the wait,
yeah.
because sometimes just to be able to get into that appointment,
Mhm. Yeah.
um, can
Yep.
definitely add to that anxiety and stress. The not knowing,
Very much so.
right?
And it's not like doctors are going to say, they're careful. So there's this process that they have to follow and do before they can definitively say, and is it to cover their asses? Yes, but at the same time it is to protect you, to make sure that if they're going to diagnose this thing, they're right. Don't let them fucking be wrong. Just saying. And
Right?
then because that would be, I can't, so
I
um
mean, I would be happy
yeah.
for a false diagnosis, don't get me wrong, you know what I'm saying? But, like, you don't want I
Yeah.
don't know. It kinda makes me think about that movie. I know, I'm sorry, but it
Hmm.
does. That movie where, with Queen Latifah where she thought she was dying, they had told her that she was dying, and she
Last
went
holiday.
she went splurging, honey. She's like, "I'm dying. I ain't gonna have to."
I love that movie. Could watch that movie over and
Right?
over.
Right? She's like, "Shoot, I'm about to splurge. Credit? Who cares about credit? I ain't gonna be in no way."
Oh, but you
No, then she
was.
found out right, and then she found out it was a misdiagnosis, and she's like, "Oh my god, I gotta pay this back." Thank you, baby. Um, okay, so maintain a healthy lifestyle. For all women, really everyone, it is important to maintain a healthy lifestyle, said Dr. Jen. That means eating balanced diets, not drinking too much alcohol, not smoking, maintaining regular physical activity, and a normal body mass index. Girl, why they ain't said that the first time I was trying to read this? That BMI stuff. Just I'm sorry.
Mhm. They gotta mix it up a little.
Okay. Don't do too much. You confuse me. But anyway, that's not okay. All of those things are likely helpful for prevention of not sorry. All of those are helpful for prevention of not just okay, got it. All of those things are likely helpful for prevention of not just breast cancer, but other cancers as well, along with heart disease,
There you
along
go.
with other things, she added.
There you go. Let's see.
I
Quit
could see that.
smoking. Yeah, for sure. Let's see. Dr. Gurin continues to say, quit smoking to lower your risk. When we think about here we go again. When we think about risk factors of breast cancer, we think about them in two categories: modifiable and non-modifiable. Okay, risk factors, says Dr. Gorin. The modifiable risk category includes smoking. Patients often think of smoking and lung cancer for sure, but in truth, smoking is also linked to higher rates of other kinds of cancer, including, wow, breast cancer, pancreatic, geez, cervical and esophageal cancer. That I knew. She said, so smoking cessation is a goal that will reduce one's risk of breast cancer and a long list of other cancers. Esophageal, I knew, and breast, yes, but I didn't know about the other things. Wow.
I even heard, I don't see it in this article, but I even heard about, it can, cause, uh, your kidneys as well. It can cause your kidney failure, the
Smoking?
smoking. Yeah,
Mm. Isn't
um,
everyone happy that they came out with that truth campaign?
girl,
I don't know how much that played a part in people stop smoking, but I think it did. I think it went a long
I
way.
think so. I definitely
Mhm.
feel like it did. Um, limit alcohol consumption. Alcohol is challenging because it's embedded in so much of our culture. Dr. Guerin said most recent data would support. Oh my.
Well, me this time.
Girl.
Mm.
Girl, I totally forgot to put her on do not disturb. I do apologize. Put that damn machine on do not disturb. I apologize.
Eh,
Um, let's see where I was at. Most recent data would support that there is an increased risk of breast cancer with even one drink a day.
wow.
Wow. Look at that. While abstinence would be ideal, it's important to meet patients where they are, she said. She added, and for many patients, moderate is a more realistic goal.
I mean, that's fair.
Wow. One drink a day? And
I
that's not
mean,
even, they said you're technically an alcoholic when you have 2 or more drinks a day.
really?
More than 2 drinks, yeah.
I can't even hang. If I drink more than one, one is like that part. I need a nap.
I'm a sleepy drunk, that part.
Give me a good glass of wine. Good night.
That's it.
Now back in the day, I used to be able to do some damage and do some stuff, but nowadays it's just like do 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 do. Ain't happening. So there are medications to reduce risk. Huh. Chemo prevention or the use of medications is another chemo prevention? I've never heard that term, but okay. Is another option to reduce breast cancer risk, says Dr. Jin. For chemo prevention, there are two classes of medications that are used. One is called selective estrogen receptor modulators, or SERMs. So is this like once, oh, this must be after you've already been diagnosed to avoid chemo. Okay, I think that's what it is. Hold on. Okay. Tamoxifen is probably the most common one that is used. SERMs medications block the effect of estrogen in the breast. Oh, okay. She said. Also, another class is called aromatase inhibitors. Those are usually used in older women after menopause and stop after hormones in the body from becoming estrogen. Whoa. However, okay, both sides have other side effects. With while tamoxifen blocks the effects of estrogen in breast tissue, dang, it can actually enhance estrogen's effects in other parts of the body. So we do worry about blood clot jam. We do worry about blood clots as well as uterine cancer. Jeez, said Dr. Jen. And then aromatase inhibitors can cause other side effects related to low estrogen, such as uh, hot flashes, bone pain, decreased bone density, and increased risk of osteoporosis and fractures.
Mm.
Geez, that's why we don't use this medication on everyone to decrease. See, to decrease breast cancer risk and reserve them for high risk women only. Again, as with every decision in medicine, we want to make sure the balance of potential benefits versus harms is in favor of benefits. So, is it me or does this read as like I thought initially maybe it's so you if you've been diagnosed so you don't have to do chemo, but that's not how this reads. It's like maybe if you have a high risk factor, then they would
Mhm.
put you. Wow.
That's what I kind of that's what I'm guessing as
Okay.
well.
Wow.
Um, okay. So,
Okay.
surgical prevention is also an option. The other kind of prevention would be surgical prevention, doctor says Dr. Jen. This is also done for women who are high risk, most commonly because of the BRCA gene mutation.
Mm.
People who have a known BRCA gene mutation, which puts them at an increased risk. Mm, sorry, my gum. Get my life together. Which puts them at an increased risk for both breast and ovarian cancer, are candidates for the surgery to remove the breast. That's called what?
Prophylactic
Pro girl. Thanks.
mastectomy. Okay, girl.
Thank you, girl, because I was over here like, girl, my head is about. I'm about to have a headache. Um, she and to think I'll be over there telling your nephew, sound out the word.
I do the same thing.
But I'm over
Sound
here
it
confused.
out.
You know, like, but I'm over here confused as all get out. And I had some college, poor kid. They also may be candidates for surgery to remove the
Mm.
Philippian foot. Oh my God, I really do know how to say this.
Ah.
Girl.
Oh, wait a minute.
Okay.
Okay.
Oh God, did we do this live? Too?
We did. The beauty of recording is we normally get to edit, but
Girl, hold on, I gotta find my place. Hold on, wait. Um,
I would have laughed too hard.
dang. Okay, hold on. Okay, here we go. Fallopian tubes or ovaries to decrease the risk of ovarian cancer as well. Sound out the word.
Yeah. Now, I
Okay.
have heard this recently. I have heard that they're starting now. I don't know that they actually recommend, like, if you feel you're confident in knowing that you are past your childbearing years, that a lot of cancers actually start in the fallopian tube. So they're actually recommending that you snip those and remove those. I don't remember. This is about a year ago. I seem to remember either reading something or some sort of news report that actually talks about this. That it starts within there as opposed to places that we may have thought of in the past or the medical field may have thought in the past. Don't quote me, y'all look it up. Talk to your doctor about it. But I seem to remember something like that recently. So testing for the BRCA gene mutation, right? These are calculators that can be used to calculate whether someone, based in their family history or ethnicity, excuse me, should get genetic testing for the BRCA gene mutation, which is a blood test, said Dr. Jin. If you have a first degree family member, such as your mom or sibling, who's had breast cancer, is known to have that gene, then you should get tested for it. If you have a family history of cancer with unknown BRCA status, that's when the calculators come into play, she said, noting they look at how many first degree and second degree relatives, whether you are of Ashkenazi Jewish descent, and certain other risk factors to decide whether you should get the genetic testing. You know, if you don't know your family history very well, like testing, I think would be really, really important. Because you wouldn't know, you know.
I agree.
Hmm.
That kind of goes back to um the one from the top,
Yeah.
right? When we first started
Um,
reading. Hold on, let me see. Okay. Breastfeeding may reduce risk. While there are no clinical trials on this topic, there is observational data that does suggest that breastfeeding is protective against breast cancer, said Dr. Jen. The same goes for having children versus not having children. Pregnancies does not seem to be pro- to be protective as well. What? Pregnancies does. I'm so sorry.
mhm.
Pregnancies does seem to be protective as well. We're not saying go get pregnant and breastfeed. Please not. Please don't.
No, unless Dr. Jen's going to help you support that child.
Child, that part.
That's why she was like, let me just tell you, it's not what I'm saying.
Look, don't you go out there doing that. Okay. Um, we're not saying getting pregnant and breastfeed. We're not saying to get pregnant and breastfeed to reduce your risk of having breast cancer. It's not practical. She added, but it does seem to be associated.
Hmm.
Okay.
I do remember that from one of the shows I used to watch. Still my favorite show. I watch the reruns every time, and I don't know if I can say the full name. SATC, SA, the city, S and the city. That one of the characters, Samantha, she ended up getting breast cancer, and they showed this scene where she goes to the doctor, and the doctor's like, kind of telling her very clinically, like, hey, these are the things that can cause it. Some people say this, da 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 da. And she was like, so what? I decided not to have children. And now it's because I didn't do this. Now I've got cancer. Like, um, it's a powerful thing to say because not every woman wants to have kids, and that's okay. Ain't nothing wrong with it. But it is important to kind of know, like, if this can, if you choose not to, all fine. But they're observing this thing, so you should be aware of it. um so birth control is okay to take. This is also somewhat controversial, but overall the link between birth control and breast cancer is very small to none, said Dr. Jen. When I talk with my patients about this, I share that using birth control pills most likely does not increase the risk of breast cancer in a clinically significant way. Furthermore, this is very this very small potential increase in risk is limited to the time that you're actually taking birth control pills. Huh. So it's not a permanent effect, it's temporary. I didn't know that. Additionally, birth control pills are protective against some other cancers, such as uterus cancer and ovarian cancer. I did not know that,
Mm.
says Dr. Gorin. Birth control pills also protect against unwanted pregnancies, which is important as well. Now, y'all don't come after us, okay? This is what the doctor's saying. Women, you do what you want with your body as you see fit. No
Girl,
judgment.
that part.
Let me just put that caveat before we continue. Birth
Girl,
control pills are a reasonable option, but it needs to be a balanced discussion of risk and benefits with your primary care doctor. Fair enough.
Mm. Be be cautious with self breast exams. There are not well, there has not, sorry. There has not been any good evidence to show that self-screening has any overall benefit in mortality,
Hmm.
said Dr. Jen. What?
Who knew? Okay.
Girl,
Isn't that
I
what
was
we've been
thinking
like? Do your
that.
self exams?
I thought that's wait, you see me over here like, "Wait, what? What?"
Okay. Huh.
Breasts are just lumpy to begin with, and a lot of people end up feeling lumps that just end up being normal breast tissue. And you may end up again going down that path of all the imaging and biopsies, and in the end, it is nothing, she added. So, self exams are not recommended by clinical guidelines. Shut
The front
your
door.
mouth.
Whoa. Well, there goes that out the window. Holy cow.
Girl, I'm over
Okay.
here like, I'm so
Whoa.
sorry. Do you hear them kids downstairs? They are back
Mm-mm.
from the
Mm-mm.
trunk or treat.
Whoa.
Wow. I had to let that sit. But like, what?
Hmm.
Crazy. Okay, let me finish. However, some people are going to be wanting to do that anyway, and that is fine. If someone really wants to stay on top of their body, I would explain that breasts can feel lumpy or bumpy, and what they are looking for is a change from the baseline. And that at the end of the day, you still know your own breasts and your own body the best, says Dr. Jen. Boy, I chopped that up. I'm sorry. I'm just hoping that you can't. Can you hear all of that commotion? I am so sorry.
I can't.
Okay. So if you are feeling something that is different that you have not felt before, then you should let it be known and we can decide at that point what to do.
Hmm.
Girl, if they are in if they are in the office with me, I am happy to do a quick exam of the breast and tell them this is what your normal breast tissue feels like. Don't be alarmed if you feel this or if you feel this. It is just normal. I'm sorry.
It's okay. And it's funny because I'll be very honest, like I have done self exams before. I'm not very consistent with it. And in part is because I've got lumpy boobs as is described in this article here. Mine are very, very lumpy. And I have had a lump before. I didn't know the difference for when it changed because I wasn't actually doing my self exams. But the reason why I never didn't do it regularly is because I always felt lumpy and bumpy. So I didn't think that I never felt like I could tell the difference. And it wasn't until like the doctor pointed it out that I was like, oh, you know what? That does feel different. But he had to say, like, this is where it is. And that's the only way I knew. Um, thank God that he was doing his job, and thank God it wasn't cancer, but it was there. Um, okay. Hashtag mom life. Y'all know it. If you don't know,
Girl,
you know. We've said it quite
girl,
a few times. Hey, sometimes we have to take a moment to attend to what our kids are needing because that's our priority. Hashtag mom life.
that part. Okay. Don't hesitate to talk to your doctor. While screenings is recommended at age 40, said Dr. Jen, if at any point you do notice something like a lump or you see something weird on the skin, or if you're having pain or any symptoms that are different than normal, that takes you out of the typical screening category, as with cancer screenings, when a symptom is detected. I'm so sorry. It's the noise in the background. It's kind of throwing me off. I really apologize, y'all. Um,
Nope, that I heard. That one I heard. It's okay. Listen, kids are
I am so
noisy.
sorry, y'all. As with all cancer screenings, when a symptom is detected that is different, you should never hesitate to bring that up to your doctor, she emphasized.
Yes, and then don't forget, like it's not always necessary a lump, right? Like she was saying, it's the skin texture around the breast, but then also if you're getting a discharge that is abnormal from your breast and you're not like breastfeeding, and there's a certain not a disease, a certain condition that may cause you to have, and I won't go all into that, but it may cause you to have some sort of, stuff um that can cause that. But if you have it's abnormal, it's something that you haven't seen before, it's not always just a lump. It may be the texture of the skin. It might be discharge that you have not had before and you're not breastfeeding. So try to, remember those things as well. So and lastly, advocate for other women too. So women, this part, women under 40 represent a group with a concerning increase in incidence of breast cancer, said Dr. Gurin. To reach women under 40 who are not recommended annual screening mammograms, there is an opportunity to connect with your friends, family, coworkers, and ask if they are addressing their modifiable risk factors and investigating their family health history. This is an opportunity for us to be each other's caregivers. That's fair. Um, and that, honestly, that's the same thing that's happening with colon cancer, that the recommended screening age has been reduced because the incidence of it is now for people, I think it's 45. So that's why now it's 45, where in the past, I think it was 50. So if you haven't had your first colonoscopy, this does depend on your state. If you're 45, you should check in with your doctor to get that initial screening. They'll tell you when they want you to come back. But it is happening younger and younger. And it's kind of hard to say sometimes that, sometimes it can be genetics and you're predisposed to it. And being an advocate for yourself, because if like if the recommended age is 45, but you know that there's a family history of XYZ, then you press your doctor and be like, hey, listen, I want to have this mammogram early. And I will share, like, I've been having mammograms since I was 35 because I had this thing that made me eligible to get screened every year before I turned 40. So you can be pressed for the things that you need. Yes, you kind of have to gotta follow what doctors say so that way they can diagnose properly. But if you're below 40, you do want to be your best advocate. Not saying it is hard, but you have to. Like, this is your health. Um, so don't be afraid to do
I
that.
agree. I agree. Like we have to be our biggest advocates. I I think about that situation even with our mother, right? Where she was like, "No, I'm not leaving until y'all tell me what is wrong." And sometimes that's what it takes. Be like, "Oh no, you well test this, test." You know what I'm saying? Do all of the things because I'd rather do all of the things and be absolutely wrong than to not do all of the things and it be um
Yeah,
really severe or be too late even in some
absolutely.
cases.
And we know insurance companies don't necessarily love this shit, but guess what?
Oh, well.
Just saying. I mean, that's what we pay. Not for nothing, but this is what we pay for. And while it's not ideal for you to have to pay for it either, but that's the whole point of this. We pay you in the event of, but then of course we got to pay more. We
Right?
just hop off this train right now.
Girl, don't get it started because I'll be right there with you, girl. I'll be like, yep. And another thing. Like,
Oh, cost sharing. We pay you, but then you
and don't
gotta
forget.
cost share. Here's your deductible. If you're lucky, it's
Hmm,
a low deductible. But what if you're not? Oh, we ain't paying for shit until you pay this $1,000. What in the actual F?
that part.
I think that is why.
Hey, someone.
Sorry. Hmm.
Sorry, baby.
I think that's possibly why medical debt is treated a little bit differently because I mean, what are you going to do? Not get health care? Because, I mean, I'm sorry, I'm going to stop there because this is a very weird, not a good time to be having that kind of conversation considering everything that's happening right now. Um, but be your best advocate and talk to your family about it. And if you feel like afraid to have this conversation with your physician, you need a new physician first and foremost, but whatever, or bring someone with
That
you
part.
to help be your voice if you are still, if you're afraid to have those conversations. But they do get easier once you put your foot down and be like, no, hey, look, doc, I need you to do XYZ. I don't care if the recommended says XYZ. We gonna do this anyway. Um, I think yes, that was the last one. If anyone would like the link, we can actually let me see. Can I drop it in the chat? This is my first time doing it. Voila. There it is. That is the link if you guys wanted to read that for yourself. There are other handy articles in it, but for breast cancer awareness, this is something that something we found that we thought would be kind of great. But they're there in the chat, so you guys can read it for yourself because some of that was a mouthful.
It was. And some of that sound out the words. That part.
Because we was a little bit on the struggle bus. Listen, I almost came on with a bonnet. All right, y'all. I almost did it.
And if I would have known, I would have fell in suit. I'd have been like, okay, no problem.
In fact,
And put back on my bonnet.
I almost came on with
Not a big
with the
deal.
bonnet and then these. Very, very nice. But if y'all get
Mm,
migraines or headaches, get yourself one of these. It's a light blocker. It helps reduce some of that glare. If you're having a headache that's like a migraine that is and light is making it worse, get yourself one of these. They're orange and it's for migraines. But we really do hope that you guys have found this to be helpful in some shape or form. Um, and I hope that you've this has inspired you to be your advocate even outside of this month here. Um, yeah.
absolutely. 100% absolutely. And um girl,
Mhm.
you know what I thought that was? I'd be so slow. Girl, I so thought somebody had put something in the chat and I was like,
Yeah.
girl, I gotta get my life together. Okay. Okay, spacing
Today
out.
is
Girl, I was
Sunday.
like,
Struggle Bus Sunday. That was
girl, this is
today.
just I'm tired. Listen, I give up. Listen, all of our ousters, our day ones that be riding with us on the struggle bus, that love us anyway.
We
Thanks so much.
appreciate you.
Our new ousters,
There you go.
so much love. Thank y'all for not judging.
And if you are, don't tell us.
Like, we don't care. Oh, no. You can tell us, "Listen,
Oh.
we can handle it." I feel like we got tough skin. I think we can take it. I don't mind a little
But
criticism.
listen, don't catch me on a bad day.
Don't get ugly with it, though. Be
That part.
respectful. Keep it respectful,
Oh,
and we'll be okay,
I lost my back.
because you get nasty, it's in there. I promise. I assure you.
Yes, and make sure you guys are
Um,
staying tuned because we got a bunch of things coming um, through the end of the year. We've got a three-part episode dedicated to a very special person, B Love, who joined us as a guest, and she shares her experience that she had with a narcissistic former partner. And it's three parts to that. So that's coming very, very soon. And then we have a phenomenal organization that agreed to be a guest for us. So make sure that you guys are following us on Tube, Spotify, wherever, um, because we've got some really important topics coming through November and beyond to certainly through November, some really key important things to so make sure you're following us on all the places. um all right, give us a second. All right, we're gonna wrap it up. All right, be patient with us.
I'm so sorry. Girl.
Don't tell your kids to be quiet because you know they're gonna get noisier. That's how they
Girl, I can't win. I can't.
I'd be like,
It is
"Bud,
what it
I'm gonna
is,
be quiet," and he gets 10 times louder.
right?
Thank
Like,
you.
"Stop stomping." "Oh, really?" Boom, 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 boom.
Why you got an
That's it.
attitude? That's just my walk. Mhm.
That. But, as always, time is something that you can't get back. So the fact that you spent this time with us and stuck with us through this whole breast cancer awareness month, and we hope you learned some things. We definitely learned some things. Did you see
For
our
sure.
face?
Yeah.
Absolutely. Learn some new acronyms.
Maybe acronyms we didn't want
Learn
to
look,
know.
look. Sound it out. Learn sounding it out. I'm sorry. But we love each and every one of y'all, and thank you for spending this time with us, because you could have been anywhere,
Mhm.
but you was definitely here with us and checking in with us. As T said earlier, please stay tuned. We have new stuff coming, but do not forget that we still have This Is Us only on YouTube,
Mhm.
and we also have the other seasons. So go on and listen on Spotify or anywhere, but you know,
Mhm.
and go look at that growth that each and every one of y'all has helped us accomplish. Mwah.
Absolutely. Have a great night.